Imagine this, a disease lurking in your body, progressing for years without a single symptom. The fear of the unknown, of what you can't see or feel, is terrifying. But what if there was a way to catch it early, long before it takes hold? What if AI could give you back the time you thought you didn't have? This isn't science fiction, it's happening right now, thanks to artificial intelligence in healthcare.
That's exactly where we are today. AI is reshaping the way we think about health. It's no longer just about treating disease. It's about preventing it, catching it before it even begins. Here in Boston, some of the world's leading minds are using AI to predict conditions like Parkinson's and cancer years in advance. This city is home to a revolution in healthcare, and AI is at its core.
Welcome to AI Frontier AI, the podcast that brings you to the front lines of artificial intelligence. I'm Max, and today, we're exploring the future of healthcare, broadcasting from Boston, Massachusetts, where history and cutting-edge technology collide. Imagine walking through the cobblestone streets of Beacon Hill, knowing that just blocks away, AI is saving lives at hospitals like Massachusetts General and being developed in labs at MIT and Harvard Medical School. This isn't just about the future, it's happening now.
Boston isn't just a city of medical breakthroughs. It's the birthplace of the AI healthcare revolution. Doctors here are using AI to go beyond the limits of human ability, predicting diseases, mapping out genetic risks, and crafting treatment plans that are so personalized. They're tailored down to a patient's DNA. AI is changing not just how we diagnose, but how we understand disease.
In today's episode, we're diving into how AI is transforming healthcare. First, we'll discuss the groundbreaking tools predicting diseases like Parkinson's long before symptoms show. Then, we'll explore how hospitals are adopting AI to deliver more precise care, reduce costs, and alleviate the burdens on doctors. Finally, we'll look at the ethical challenges, because with great power comes great responsibility. How do we protect patient privacy? How do we prevent bias in AI systems that could mean life or death?
Boston is more than just the backdrop to this revolution. It's the driving force. Here, in the heart of the city, AI is not only catching diseases earlier but changing how patients live. Imagine an AI system that doesn't just diagnose cancer, but predicts which treatments will work best based on your genetics and health history. This isn't the future. This is happening right now.
But AI's reach doesn't stop at hospitals. AI-powered wearables are tracking your heart rate, sleep patterns, and even stress levels in real time. AI is in your pocket, on your wrist, and soon, in every aspect of your health. Boston is where tradition meets technology, and today we're exploring how this city is shaping the future of medicine.
In this episode, we'll uncover how AI is pushing the boundaries of what's possible. We'll explore AI's role in disease prediction, personalized medicine, and even mental health. But with all this promise comes critical questions. How do we ensure patient data stays secure? How do we prevent AI from making biased decisions? And most importantly, how do we make sure these tools benefit everyone, not just a select few?
Whether you're a doctor, a patient, or simply someone curious about the future of healthcare, this episode is for you. Join us as we explore the cutting-edge AI tools that are making healthcare more precise, more personal, and more accessible. And don't forget to subscribe to AI Frontier AI on your favorite podcast platform, whether that's Spotify, Apple Podcasts, or wherever you listen. The future of healthcare is happening now, and you don't want to miss it. Let's dive into some of the most exciting AI breakthroughs in healthcare. First up, researchers have developed an AI model that can predict Parkinson's disease risk up to 15 years in advance. Think about that, a tool capable of analyzing vast amounts of patient data, from medical records to imaging scans, to detect subtle neurological changes long before any physical symptoms show. This development is a major leap forward in preventive healthcare and could give millions of patients the opportunity to prepare and seek early intervention.
Exactly. Parkinson's is notoriously difficult to diagnose in its early stages. By the time most people realize something is wrong, the disease has already progressed significantly. The ability to predict it so far in advance means doctors can work with patients on preventative measures, from lifestyle adjustments to early treatments that could delay the onset of symptoms. This is about more than managing diseases. It's about changing the trajectory of a person's health before the disease takes hold.
And this predictive ability isn't just theoretical. It's being tested in clinical settings right now, with promising results. Doctors are already using AI to analyze genetic data, brain scans, and even environmental factors that might contribute to Parkinson's. It's a game changer for both patients and healthcare providers, shifting healthcare from reactive to proactive.
AI's role in predictive diagnostics doesn't stop with Parkinson's. New AI tools are being integrated into the diagnostic workflows for cancer detection. These tools analyze thousands of medical images, whether from CT scans, MRIs, or biopsies, to identify patterns that even the best human doctors might miss. In fact, AI is proving particularly effective at detecting early-stage breast cancer, where small, subtle changes in the tissue might otherwise go unnoticed.
That's a huge breakthrough, especially considering how crucial early detection is for survival rates. Studies have shown that when cancer is caught in its early stages, the chances of successful treatment increase dramatically. AI is helping doctors make these early diagnoses with greater accuracy, reducing false positives and false negatives. It's also speeding up the process. What used to take hours of manual review by a specialist can now be done in minutes, with AI helping radiologists pinpoint the areas that need attention.
Another area where AI is making waves is in lung cancer diagnosis. By analyzing not just individual scans but entire patient histories, AI can give doctors a more complete picture of a patient's risk profile. This means doctors can detect lung cancer earlier and with more precision, even when the initial scans might show inconclusive results. It's changing how we approach cancer treatment as a whole.
And AI isn't just for these high-tech diagnostic tools, it's becoming a key part of everyday medical practice. A recent report revealed that 1 in 5 general practitioners in the UK are now using AI tools like ChatGPT to assist with tasks like answering patient inquiries, drafting initial treatment plans, and even helping with symptom analysis. These tools are freeing up doctors' time so they can focus more on direct patient care, especially for complex cases that require human expertise.
That's a major shift in how GPs work. Instead of spending hours on paperwork or administrative tasks, AI helps streamline their workflow, allowing them to see more patients and spend more time with those who need more attention. In healthcare systems where doctors are increasingly overburdened, this kind of support could dramatically improve both patient care and doctor satisfaction.
What's remarkable is how quickly these AI tools are becoming essential, even in smaller, rural practices. It's not just about easing workloads, it's about improving diagnostic accuracy and ensuring patients receive the right care faster. From predicting diseases to helping doctors work more efficiently, AI is fundamentally changing how healthcare operates, making it more personalized and more precise.
AI is reshaping healthcare at every level, from early disease prediction to daily clinical practice. It's helping doctors, patients, and healthcare providers work more efficiently, make more accurate diagnoses, and provide more personalized care. The future of healthcare is here, and AI is leading the charge.
Let's dive into some of the most exciting AI breakthroughs in healthcare. First up, researchers have developed an AI model that can predict Parkinson's disease risk up to 15 years in advance. Imagine that, a tool that scans through mountains of patient data, from medical records to brain imaging, detecting the subtle changes that even the sharpest human eyes might miss. This is a massive leap in preventive healthcare, where early intervention could mean the difference between managing a disease and living a full, healthy life.
Exactly. Parkinson's is one of those diseases that often goes undiagnosed until it's too late to reverse its effects. The fear of unknowingly carrying a disease like that is something we can all relate to. But with AI, that fear could be mitigated. Doctors can now catch the signs early, giving patients time to change their lifestyle, time to start treatments that might slow the disease, and time to prepare. This isn't just about managing a condition. It's about giving people their lives back.
And this isn't a concept, this technology is being tested in clinical trials right now. With the ability to analyze genetic data, family history, and even environmental factors, AI can deliver a diagnosis far earlier than traditional methods. This is healthcare at its most proactive, stopping diseases before they even start.
AI's predictive power is already changing how we approach cancer diagnostics as well. New AI tools are being integrated into diagnostic workflows, helping doctors catch cancer at the earliest stages, when treatment is most effective. These tools analyze thousands of medical images, from CT scans to biopsies, identifying patterns that are nearly invisible to the human eye. It's a game changer for cancers like breast cancer and lung cancer, where early detection is often the difference between life and death.
That's a huge breakthrough. When cancer is caught early, the chances of successful treatment increase dramatically. AI is helping doctors make these critical diagnoses faster and with greater accuracy, cutting down on false positives and false negatives. In fact, what used to take hours of meticulous manual review can now be done in a fraction of the time. And when you're talking about cancer, every minute saved could be a life saved.
The impact of AI goes even further. In the fight against lung cancer, AI can analyze not just the scan in front of the doctor, but the entire patient history, genetics, lifestyle factors, and past medical conditions, giving a more comprehensive view of the patient's risk profile. This allows doctors to make data-driven decisions that are more accurate and tailored to each individual. It's not just about finding cancer. It's about understanding the patient behind the scan.
And it's not just happening in specialized clinics. AI is becoming an everyday tool for doctors worldwide. A recent report revealed that 1 in 5 GPs in the UK are now using AI tools like ChatGPT to assist with day-to-day tasks, answering patient queries, drafting treatment plans, and even analyzing symptoms. These tools are giving doctors more time to focus on complex cases and less time on paperwork.
This shift is massive, especially in healthcare systems that are stretched thin. Imagine being a GP with a waiting room full of patients and knowing that AI can help handle the routine inquiries, allowing you to focus on what really matters: patient care. AI is allowing doctors to see more patients, spend more time with those who need it most, and ultimately, improve the quality of care for everyone.
The potential is huge, not just for major hospitals, but for small clinics in rural areas where access to specialists is limited. AI is leveling the playing field, bringing world-class diagnostic tools into the hands of every doctor, no matter where they are. It's improving diagnostic accuracy, reducing human error, and making healthcare more accessible to everyone.
That's what's so exciting. AI is reshaping the healthcare landscape from every angle. Whether it's predicting diseases before they happen, speeding up diagnoses, or helping doctors handle their workloads, AI is making healthcare more efficient, more accurate, and more personalized. The future of medicine is here, and AI is at the forefront of that transformation.
AI isn't just a tool for diagnostics, it's changing how entire healthcare systems operate. Hospitals and clinics around the world are adopting AI to improve patient outcomes and reduce costs, from streamlining workflows to making complex surgeries more precise. One area where AI is making a significant impact is in predictive diagnostics, which allow hospitals to predict patient outcomes even before they're admitted.
Exactly. Think about a hospital that can anticipate which patients are most likely to need intensive care, based on real-time data. AI systems are helping healthcare providers allocate resources more efficiently, ensuring that doctors and nurses are in the right place at the right time. This reduces wait times, improves patient care, and ultimately saves lives.
And it's not just patient care that's changing. AI is also transforming the way hospitals manage their operations. By analyzing data on patient flow, treatment times, and resource use, AI can recommend more efficient ways to manage hospital systems. In fact, some hospitals are already reporting up to a 20% reduction in patient wait times thanks to AI-driven scheduling systems.
Hospitals are constantly dealing with fluctuating patient numbers, which makes staffing and resource management a logistical nightmare. But AI systems can analyze patterns and predict when the busiest times will be, allowing hospitals to adjust staffing and resources accordingly. This means fewer bottlenecks, more efficient care, and ultimately, a better patient experience.
AI is also playing a critical role in surgical procedures. Surgeons are increasingly using AI-assisted systems to improve precision during complex surgeries. These systems provide real-time guidance during procedures, helping surgeons make microadjustments that lead to better outcomes. For example, in delicate operations like neurosurgery or cardiac surgery, where a millimeter can make all the difference, AI is helping to reduce the margin of error.
That's an exciting development. One surgeon described AI as having an extra set of eyes during surgery. These systems can flag potential issues that might not be visible to the surgeon, or even predict complications based on the patient's data. This reduces the risk of errors and leads to faster recovery times for patients. AI-assisted surgery is just one example of how technology is augmenting, not replacing human expertise in healthcare.
AI's ability to analyze massive datasets and provide real-time recommendations isn't just changing surgeries, it's improving outcomes across the board. Take telemedicine as another example. With the rise of virtual care, especially since the pandemic, AI is playing a key role in supporting doctors during online consultations. AI-powered virtual assistants can help doctors access patient records, recommend diagnoses, and even suggest treatment plans during video consultations, making the process more efficient and more effective.
This kind of technology is making healthcare more accessible, especially for patients in rural or underserved areas. Patients who may not have easy access to specialists can now receive the same level of care through virtual consultations powered by AI. And for doctors, having AI assist with routine tasks means they can spend more time focusing on their patients, rather than being bogged down by administrative work.
That's the key. AI is reducing the administrative burden on doctors, allowing them to focus on what really matters, patient care. Whether it's managing appointments, helping with triage, or even handling routine follow-ups, AI tools are freeing up doctors' time and making healthcare more efficient for both providers and patients.
And as AI continues to evolve, we're only going to see these systems become more integrated into healthcare workflows. Imagine a world where your healthcare provider doesn't just treat you when you're sick, but uses AI to predict your health risks and helps you take steps to prevent illness before it even starts. That's where AI is taking us, towards a future of personalized, proactive healthcare that's more precise and more effective.
For patients, this shift means more than just quicker diagnoses and better treatment plans. It means peace of mind, knowing that AI is working in the background to keep them healthier for longer. Imagine recovering from surgery faster because AI guided every millimeter of the procedure. Or imagine a world where the hospital knows exactly when and where to deploy staff, reducing wait times and ensuring that every patient gets the attention they need, exactly when they need it.
Ultimately, AI in healthcare is about more than just efficiency. It's about transforming the patient experience. It's about getting patients the care they need, faster and more accurately, and giving them the best chance at a healthy future. Whether it's predicting diseases, assisting in surgeries, or providing virtual care to remote communities, AI is making healthcare better for everyone.
Now that we've seen how AI is transforming hospitals and clinics, let's talk about how AI is changing healthcare for individuals, people like you and me, in their daily lives. The most immediate impact of AI on our health comes from wearables and health apps that are already in millions of homes around the world. From smartwatches that track your heart rate to apps that monitor your sleep patterns, AI is helping individuals take charge of their health in ways we couldn't have imagined a decade ago.
Absolutely. Take fitness trackers as an example. Many of us wear them every day, monitoring everything from how many steps we take to how well we're sleeping. But these aren't just passive devices. They use AI to analyze the data they collect and offer personalized insights. For example, if your heart rate is irregular or your sleep patterns show signs of stress, the AI algorithms can alert you in real time and recommend changes to your lifestyle. It's like having a mini doctor on your wrist.
And it's not just about fitness anymore. AI-powered wearables are now capable of detecting potentially dangerous conditions like atrial fibrillation, a heart rhythm disorder that can lead to stroke if left untreated. There are already multiple stories of people who discovered they had this condition thanks to a notification from their smartwatch, giving them time to see a doctor before a serious event occurred. These technologies are saving lives.
That's a huge shift. We're talking about AI empowering individuals to be more proactive about their health. But it's not just wearables. Health apps are also revolutionizing the way we manage chronic conditions. For example, people with diabetes can use AI-powered apps to monitor their blood glucose levels in real time. These apps can analyze patterns, predict fluctuations, and even recommend insulin adjustments, helping individuals avoid dangerous spikes or crashes.
And AI doesn't just stop at monitoring. It's helping people prevent diseases before they happen. Imagine an AI-powered app that analyzes your genetic makeup, your lifestyle choices, and your medical history to give you personalized recommendations. It might tell you which exercises are best suited for your body, or which foods to avoid based on your unique metabolism. This is the future of personalized health, where AI is a key partner in helping individuals stay healthier for longer.
The personalization is what's really exciting. We've moved from one-size-fits-all healthcare to a future where your health recommendations are tailored to your unique biology and lifestyle. And it's not just about reacting to symptoms. AI is helping people take preventive measures based on their data. For example, AI-powered platforms can analyze patterns in your blood pressure, sleep, and activity levels to alert you about potential health risks before they become serious.
It's incredible how far we've come. There are even apps that use AI to track mental health, monitoring mood changes, stress levels, and even depression. These apps can suggest exercises, mindfulness practices, and, if necessary, connect users with mental health professionals. In a world where mental health is becoming increasingly important, AI is providing tools that help people manage their well-being more effectively.
And the accessibility is what makes this so powerful. AI is giving people the ability to manage their health at home, without needing constant in-person visits to doctors. For those with chronic conditions, AI helps them avoid hospital visits, manage medications, and track symptoms in real time. It's a more efficient way to live, and it's giving individuals a sense of control over their health that they never had before.
What's exciting is that these tools are only going to get smarter. As more data is collected, AI algorithms are constantly improving, learning more about our bodies and how we respond to different treatments or activities. The future of healthcare is moving beyond hospitals, it's moving into our homes, onto our devices, and into our daily routines. We're living in a time where AI is democratizing healthcare, making it accessible and personalized for everyone.
But beyond the convenience and personalization, the real impact of AI in healthcare is peace of mind. Knowing that your smartwatch or health app is monitoring you in the background, alerting you to potential health risks before you even realize they exist, gives people a sense of security that's truly life-changing. For those with chronic conditions, it means fewer sleepless nights worrying about their health. For the rest of us, it's about living healthier, longer lives with AI as our partner in care.
Ultimately, AI is giving individuals more control over their health, putting them in the driver's seat. It's not just about diagnosing or treating diseases, it's about helping people stay well, preventing issues before they even arise, and giving people the tools to live healthier, more proactive lives. And in a world where time and health are two of our most precious resources, AI is helping us protect both. With all the incredible breakthroughs AI is bringing to healthcare, there's also a lot to think about when it comes to the ethical implications. On one hand, AI is helping save lives and improve healthcare delivery. But on the other hand, we have to consider how these tools are developed and used, especially when it comes to data privacy and the potential for bias.
Exactly. The more AI gets involved in healthcare, the more personal data it processes. We're talking about medical histories, genetic data, and even real-time health information from wearables and apps. As much as AI is improving healthcare, we have to make sure that this data is being used ethically and that patients' privacy is being protected. If we lose trust in how this data is handled, the entire system could be at risk.
Data privacy is one of the biggest concerns in AI healthcare. Who has access to this data? How is it stored? And, most importantly, how is it used? It's one thing to use AI for diagnosis, but if that same data is shared without consent or used in ways the patient isn't aware of, we start crossing some serious ethical lines. This is where healthcare providers, governments, and AI developers need to work together to create strict guidelines that protect patient data.
And it's not just about privacy, It's also about bias. AI systems are only as good as the data they're trained on. If that data is biased in any way, whether it's skewed towards certain populations or reflects existing inequalities, those biases will be built into the AI. And in healthcare, that can lead to life or death consequences. Imagine an AI that's better at diagnosing certain diseases in one group of people but not in others because it was trained on biased data.
That's the real danger. If AI systems are biased, they could end up widening healthcare disparities rather than closing them. For example, if an AI tool is trained on data that mostly comes from people of a certain race or background, it might not perform as well for people from different groups. This could mean that certain patients receive suboptimal care simply because the AI doesn't work as well for them.
This is where algorithmic transparency becomes crucial. Developers need to ensure that the data being used to train AI is diverse and representative of the entire population. And just as importantly, the algorithms themselves need to be transparent. Healthcare providers and even patients should be able to understand how AI systems are making decisions. This will help build trust and make sure that AI is being used in the right way.
Another major concern is the potential for AI to replace human doctors. While AI is an incredible tool for helping doctors, there's a real fear that it could one day replace them altogether. This raises ethical questions not only about the quality of care, but also about the human touch in medicine. Can an AI truly replace the compassion and intuition that comes from human doctors?
That's a critical question. Healthcare is as much about empathy and understanding as it is about diagnosis and treatment. AI can enhance the decision-making process, but it can never replace the emotional intelligence and personal connection that human doctors provide. This is why it's so important to think about AI as a support tool, not a replacement. We need to strike the right balance between leveraging AI's strengths while keeping the human element at the center of healthcare.
As AI continues to advance, it's clear that we need ethical guidelines and regulatory frameworks in place to make sure it's used responsibly. Governments, healthcare organizations, and AI developers all have a role to play in ensuring that AI is designed and implemented in ways that protect patient privacy, reduce bias, and keep doctors at the heart of healthcare.
The future of AI in healthcare is incredibly exciting, but it comes with its own set of challenges. If we can navigate these challenges by protecting privacy, ensuring fairness, and keeping humans at the center of care, AI has the potential to transform healthcare for the better. But it's up to all of us to make sure it's done in a way that benefits everyone, not just a select few.
And ultimately, this isn't just about technology, it's about trust. Patients need to know that the AI systems helping their doctors are working for them, not against them. They need to know that their data is safe, their treatments are fair, and that the human element in healthcare is never lost. Because when it comes down to it, healthcare isn't just about algorithms, it's about people. And ensuring that AI supports the well-being of every individual, no matter who they are, is the true measure of success.
That's right. At the end of the day, trust is the foundation of any healthcare system. As AI continues to evolve, it's up to us to build systems that patients can trust, systems that protect their privacy, treat them fairly, and keep their doctors by their side. Only then can we truly unlock the potential of AI to improve healthcare for everyone.
As we've explored today, AI is already transforming healthcare in profound ways, from predicting diseases long before they show symptoms, to personalizing treatments, to helping doctors make faster and more accurate diagnoses. But what does the future hold for AI in healthcare? What can we expect as these technologies continue to evolve?
The future of AI in healthcare is incredibly promising. We're already seeing how AI is making healthcare more proactive, helping doctors intervene earlier and with more precision. But what's even more exciting is how AI is pushing the boundaries of personalized medicine. Imagine a future where treatments are tailored not just to a person's disease, but to their unique genetic makeup and lifestyle. AI will allow us to develop therapies that are as unique as the patients they're designed to help.
That's where the power of AI lies, in its ability to analyze massive amounts of data and provide personalized insights that were previously impossible. We're talking about a future where AI helps doctors not only treat diseases but prevent them before they even start. As AI continues to improve, we'll see more tools that predict not just when someone will get sick, but how they can stay healthy for longer.
And it's not just about preventing diseases. AI will also play a big role in chronic disease management. For example, people living with diabetes, heart disease, or even mental health conditions will benefit from AI-powered apps and wearables that monitor their health in real time and provide personalized recommendations on how to manage their conditions. This could mean fewer hospital visits, fewer complications, and better quality of life for millions of people.
The key takeaway here is that AI isn't just a tool for doctors, it's becoming a partner in health for all of us. From helping doctors make more informed decisions to giving patients more control over their own health, AI is reshaping healthcare at every level. And the more data these systems have access to, the smarter and more personalized they'll become.
That's right. But with all this promise comes responsibility. As we discussed earlier, AI in healthcare needs to be implemented ethically, ensuring that patient data is protected, bias is minimized, and that doctors remain at the center of care. The future of healthcare with AI is bright, but it's up to all of us, developers, healthcare professionals, and policymakers, to make sure it's done the right way.
So what should we be watching for in the coming months and years? First, we'll see continued advancements in predictive diagnostics. AI will get even better at detecting diseases earlier, giving patients more time to prepare and doctors more time to plan treatments. We'll also see AI play a bigger role in surgical procedures, where it will provide real-time assistance during complex operations, helping surgeons make precise, data-driven decisions.
Another area to keep an eye on is the integration of AI in mental health care. We're already seeing AI-powered apps that track mood changes, stress levels, and other indicators of mental health. In the future, these tools will become more sophisticated, helping people manage their mental well-being more proactively, and even predicting mental health crises before they happen.
AI will also continue to improve healthcare access. As telemedicine grows, AI will help bridge the gap for patients in remote areas or underserved communities, giving them access to the same high-quality care that people in major cities enjoy. This could truly democratize healthcare, making it more equitable and accessible for everyone, regardless of where they live.
And we can't forget about the potential for global collaborations in AI healthcare. As AI systems become more powerful, we'll likely see more international partnerships aimed at setting standards and sharing data across borders. This kind of collaboration could accelerate the development of life-saving technologies and bring cutting-edge healthcare to people all over the world.
At the end of the day, the future of AI in healthcare is about more than just technology. It's about giving people more time, time to live, time to heal, and time to spend with the people they love. AI is helping us move towards a future where healthcare isn't just about treating diseases, but about empowering people to live healthier, fuller lives.
So as we look ahead, let's remember the potential AI holds, but also the responsibility that comes with it. AI has the power to revolutionize healthcare, but it's up to all of us to make sure that revolution is ethical, inclusive, and truly beneficial for everyone. The future of healthcare is bright, and with AI it's only getting brighter.
As we wrap up today's episode, it's clear that AI is reshaping the future of healthcare in ways we couldn't have imagined just a few years ago. From predicting diseases like Parkinson's years before symptoms show, to personalized treatments that are tailored to each patient's unique biology, AI is moving us toward a future of proactive, precise, and personalized care.
That's right. AI is giving doctors the tools they need to catch diseases earlier, treat them more effectively, and even prevent them before they start. It's empowering individuals to take control of their health with wearables, apps, and AI-powered tools that provide personalized insights. But as we've discussed, the power of AI comes with great responsibility. We must ensure that AI is developed and used ethically, with a focus on privacy, fairness, and keeping doctors at the center of care.
The future of healthcare is bright, but it's up to all of us, developers, healthcare providers, and policymakers, to make sure AI is implemented in a way that benefits everyone. AI has the potential to democratize healthcare, making it more equitable, accessible, and affordable for all. But we have to make sure that the technology is used responsibly and that patients' trust remains intact.
As AI continues to evolve, we encourage you to stay informed and engaged. The future of healthcare is happening now, and it's happening fast. If you want to be part of this revolution, make sure to stay updated on the latest developments in AI in healthcare. And don't forget, AI is just a tool. It's the people, doctors, patients, developers, who will ultimately determine how successful this technology will be in improving health outcomes for everyone.
We hope today's episode gave you a glimpse into how AI is transforming healthcare and how it's just the beginning. There's so much more to explore, and we'll be diving into even more exciting topics in future episodes. Make sure to subscribe to AI Frontier AI on your favorite podcast platform, whether it's Spotify, Apple Podcasts, or wherever you listen. And follow us on social media to stay part of the conversation.
But more than just technology, this is about you. AI is already in your life, in your pocket, on your wrist, and soon, it will be even more embedded in your healthcare journey. Imagine a future where your health is constantly monitored, where early detection gives you more time with your family, and where AI helps you live longer and healthier. Together, we can shape a world where healthcare isn't just about treating illness, but about empowering people to live their best lives.
So, whether it's predicting diseases, guiding surgeries, or just helping you stay on top of your daily health, AI is changing the way we live. The future of healthcare is about giving us all more time to live, to heal, and to thrive. Thanks for joining us today, and we'll see you next time on AI Frontier AI. And before we sign off, please note that the information provided in this episode is for informational purposes only and does not constitute professional or financial advice. Always do your own research or consult with a professional before making any decisions based on what you've heard today.
The sources of the information discussed in this episode include trusted publications and expert insights from various reputable outlets. Music used in this episode includes Night Runner by Audionautics, provided under the YouTube Audio Library license.
Thank you for joining us today. We'll see you next time on AI Frontier AI as we continue exploring the future of artificial intelligence and its impact on healthcare and beyond.
This episode is copyrighted by Finance Frontier AI. All rights reserved.